Hi, I'm Dr. Yvonne Duffe, and I'm glad you decided to check out our website. I assume that you've read some of it already, so you know that I'm a native Floridian and that I've moved back to the Orlando area about 11 years ago to set up practice, and about 7 years ago. As an osteopathic physician, if you don't know what that is, we are trained the same way the MDs are trained, plus we have 2 years of manual medicine, very similar to what chiropractors do. And this is really important because that musculoskeletal system that's part of our training makes up about 70% of our bodies. And if we just function on the organ, we're going to miss a lot of those connections because you can't take away our brain and our organs from the rest of our body. But in addition to that, I do everything the MDs do. I do medication. My colleagues are trained in surgery, obstetrics, gastrointestinal, every other specialty there is, but we also have that incorporation. We also have a lot of emphasis on being a whole doctor, that we treat the whole person and that we don't try to isolate one organ from the rest of the person. And as a family doc, which is what I went into, I have always tried to make sure that I pay attention to that whole person. And that means I have to listen to my patients, because there is no way that I can treat the whole person without actually listening to my patients. Many of my patients have commented that I'm often the first person they felt really listened to them. I don't know if that's true or not, but that's what they tell me. But there's the common practice, or maybe not so common, it's what I try to practice, of doing unto others as you would have them to do. So I treat every person the way I would want to be treated, and so far it's worked. We do full family medicine here from ages 2 to 102, and we've been doing that for years. But recently I've become enamored of integrative medicine, which is getting back to the functional medicine. Now, every doctor is taught biochemistry when they enter medical school in that 2 years, especially their freshman year. They get a full course in biochemistry, and part of that course happens to do with nutrition. And of course they get a course on physiology. But then layered on top of that, they start getting into the clinics, and they start getting into the drugs, and we start getting to everything else. But we're supposed to remember that biochemistry and physiology in everything we do. Unfortunately, that's a whole lot of information to learn, and there's always new data coming out on that, and it's really hard to keep up on that. But part of integrative medicine is incorporating what's called functional medicine, getting back to those basics and integrating that back into treating the whole person, and not so much relying on the drugs and the procedures to do all our work for us. So I've been working on that and adding that into my practice. One of the things that I really love to do is to teach my patients. I do have a master's in medical education. I taught medical students for 4 years and decided it was time to get out and actually treat more patients. And I love it when I'm able to tell somebody how to incorporate wellness and lifestyle changes into their life that helps them prevent the diabetes and prevent the high blood pressure and prevent some of the back pain and all those other myriad chronic conditions that the stresses in our life tend to aggravate. So with the wellness, with the integrative medicine, I've been starting to add wellness curriculums into my practice, and where we're teaching the patient how to stay well. So those are a new part of our practice, and we're cooperating with holistic nutritionists and physical therapists, and we have a whole exciting new program that we've added to our usual services of being a very good and excellent family physician is what I try for. you'll see on the website the number for our office is 407-447-9596. And we're accepting new patients all the time. We try to keep urgent visits open every day because no one knows when they're going to come down with a new illness, an acute illness, a cold, a cough, an injury. So we always try to keep enough slots open that we can get people in within 24 to 48 hours for those things. And we hope to see you soon. Thank you very much for joining us here on the website. Oh, stay tuned in the future because I'm planning on adding more newsletters and some videos on some nutritional things that are real exciting, like the vitamin D, some new diet information, new cholesterol guidelines. Those things will be coming up soon. So stay tuned. Thank you.